Hello, hello, hello. Welcome back to Moment with Winnie. So, I know it's been a while. I know, but your girl is back. So, today I'm going to talk to you about the various specialties that we have in a Master's in Public Health program. So when you decide to do Masters in Public Health, other schools allow you to choose specializations from the beginning. Other schools do not. My school allowed me to choose my specialty from the beginning. So what are these specialties, right? And what do these specialties do? So public health is expanding. It is not just about research into diseases. It's not just about environmental health. It has so many factors of it. So some of these factors are the health policies and management, the social and behavioral health, we have the environmental health, we have biostatistics, we have epidemiology, and so many. If you ask somebody, they're going to list a lot, but these are the few ones I want to concentrate on because most of these are intertwined in between. So with health policy and management, their main concern is to help with the delivery and accessibility of quality of healthcare, right? The cost of healthcare for individuals in the population. They also look at the managerial aspect of it and the policy perspective, how these policies can be put in place, good policies to be put in place for the healthy part of people, right? Like healthcare. You don't want to go to hospitals and you want to cost outrageous. So these people look into these policies, the cost and everything, the regulations that comes with it. People who do health policy and management do work in various public health sectors, the hospitals, the health department, name it. These people work there because they have to put in the policies and the regulations to be maintained, to be able to help us maintain a very good running health system and for us to have a healthy life with less cost, right? Okay. And then we have the people who do in social and behavioral aspects of public health. So these people, they look at how the social, like the behavior, the cultural aspects of the people in the society, in the community, and how these things or how these cultural or physical or social or behavioral part of our lives affect the public health, right? Affect our health. So these people look into these issues. And people like this do work with the NGOs, they work with mental health facilities, they work in academia, or they work in hospitals, public places. They work in every place that someone needs help for health. Somebody with a social and behavioral background can work there. Let's look into environmental health. People who decide to focus on environmental health as their specialty look into the biological, the physical, the chemical factors that affect our environment, right? The global warming people, the biohazard people. They look into all those things, the airborne pollution, the water pollution. They look into those things and then they try to find ways and means to prevent it or even to curb it, right? To reduce it, just so we could have healthy lives. And these people work in the government sector, they work in hospitals, they work in research, they work in academia, they work everywhere that environmental health is needed. Some of them even work as occupational health persons in companies to prevent people from being exposed to hazard or falls or other things that happen. So these people do work in places like that. And then we have people who specialize in biostatistics. So biostatistics, they address the public with health issues and then they analyze and interpret the data, right? So these people look into data. If I am not mistaken, I can say a typical example would be when we had COVID. They have written down all the statistics, what happened in each state in numbers. Now they are reading it to see is the cases increasing, are the cases reducing based on the numbers they have. They have their graphs, their diagrams, all those things. So these people look into that. Biostatistics, that is all they want to do. Research, put numbers, explain it to us, let us know whether there's a decrease, an increase, a decrease, whether it's stable. They deal with the numbers, those people. Yeah. And then we have epidemiology, right? So epidemiology is the study of diseases, including how we detect the diseases, what causes the diseases, the patterns, the control of the diseases, especially the infectious diseases, right? So you look at all these things, and then you want to study with epidemiology. They study the diseases and its associated risks, the determinants, and then they use statistical or epidemiological methods. Yeah, I know. Method for data analysis, right? Then they research the designs and transfer this information into oral, like written words that they can present to you. So let me give you an example. Example is when COVID came, right? They sat down, looked into the disease, what causes the disease, how are we going to curb the disease, right? How are we going to control the disease? So they put it all with the help of the biostatistics people. They brought the statistics together, they wrote it. And that is how we got to know that with COVID, we have to put on masks. With COVID, we have to wash our hands. We have to do all these things. So when they research into those diseases and then they find the root cause of the diseases, then they bring measures to put the diseases to an end. So the oral one is when they're able to come tell you, I want you have to wash your hands, stay 6 feet away from people. That is when they put those statistical methods into oral or written forms to let you know that this is how diseases can be kept or treated, or how they cause. So these are the few specialties that I want to talk about. My take is every school has its own way of putting it, right? Or head the topic, or how they name their courses. My school names it this way. I don't know about your school, but guess what? The naming might be different, but what you do will be the same. So my thing is, before you choose a specialty, when you start doing your application process and when you want to do your master's in public health, before you choose a specialty, you have to sit down and think, do any of these specialties spike my interest? So if it is policies, if it is environmental health, biostatistics, any of them, or epidemiology, any of them, whichever one spike your interest, read into it. If it is what you want to do, then you apply to it. If your school doesn't give you the option for specialties in the beginning, they surely give it to you as the program goes on. So do not just go in blindly because your friends are doing it. Go in because because of the interest you have in it, and because it leads to your career path. Think about these before choosing, because you do not want to finish your program and say, oh, I didn't get anything from my public health that I did. It's because you did not read into the specialties before you chose them. So please do your own research, and if you find this video educative, please don't forget to give it a thumbs up, subscribe to my channel, and turn on the notification. And anytime I post new videos, you'll be the first to be notified. Welcome to Moment with Winnie.